Hello, I'm Dr. Dennis McKenna, once again joined by Dr. Fred Venditti, the Hospital System General Director, giving you the update from Albany Medical Center. Today is Tuesday, August 25th. Well, it's good to see you again.
Welcome back, Dennis.
I missed you.
I missed you too.
But now you had Diane Shagru, the CEO of Glens Falls here, which was great.
CEO of Glens Falls.
And Kate Keefe, one of our nurse leaders, and it was great.
It was. You know, we talked about the transplant program. Yes. There was something we didn't mention, which are the statistics on the outcomes for the transplant program. So this is the kidney transplant program that 50 years we've had. The statistics from UNOS were just published, and we're in the top 3, Dennis, for survival of patient and survival of the kidney.
Top 3 hospitals in the country.
Wow. Absolutely fantastic results. Yeah. And you know, we've actually been number 1 at times.
I know.
Great program.
Well, and I'm sure you mentioned Dave Conti and the whole team last week.
Absolutely. They're absolutely terrific.
So very proud of them. Well, I'm glad we shared those statistics. So let's jump in and talk a little bit about COVID. We'll begin with the Capital Region numbers. They don't look much different than when I was going a week ago. We're currently at 42 in the 8 counties of the Capital Region. The next graph shows admissions and discharges here at the medical center. And Fred, interestingly, we've had a couple days now where we've had admissions. We haven't had any discharges.
Oh, that's right, Dennis.
So you can see above that horizontal line some blue and nothing below. We obviously hope some people will be discharged in the next day or two. But what that's translated into in the hospitals, we currently have 15 here on the morning census. And we have 9 on the floor. We have 6 in the ICU and 2 on ventilators. So that is a little bit of a change.
It is. The 2 people on ventilators have been on ventilators now for multiple days, almost a week, I think.
So I guess it is a reminder to all of us that COVID-19 is something that we take very seriously. As we've said for a while, we expect that we'll be dealing with this for quite some time. And there will be people who will need to come into the hospital, some who will need the ICU, and some that may need ventilators. But the population appears to be similar to what we've been experiencing.
Yes, Dennis, it is an older population, you know, and many of them in their 70s, 80s, and even I think a couple in their 90s.
And it's also a good reminder for us to thank our staff. We still have people on the front lines every day wearing the PPE, being safe, taking care of that population.
Yes.
One of the treatments that we've been doing from the very beginning is the treatment of convalescent plasma. So to remind ourselves, if someone has had COVID-19 or been exposed to it, they might create antibodies. There's a way for a donor to give their plasma through the Red Cross and have that transfused back into sick people. Fred, I think we've done almost 100 people from the very beginning.
We have, Dennis. We've been part of the Mayo study.
Right. And Dr. Mark Judson and his research coordinators have led that effort, which has been incredible. Recently, the government announced that now they're going to expand the use of convalescent plasma a little bit more liberally.
That's right, Dennis. So they've done something called an EUA, an emergency use authorization, to allow others to infuse plasma. And it's based on the study that was done by Mayo that we were part of. 70,000 people received plasma. If you received it under 3 days after your diagnosis, so within that very short window, you only had a 9% mortality, and even the population beyond 3 days had a 12% mortality. So relatively small mortalities, and earlier seemed to be better.
And the results nationally seem to line up with what our experience was here as well.
Yes,
that
absolutely.
Giving the plasma seemed to help. And we were very early doing that here, which is great news.
We were. Now, there's still an ongoing study comparing it to placebo. So we'll see what that shows. That'll be the final, you know, firm bit of fact that tells us that, yes, plasma does work.
And you used the term EUA, Emergency Use Authorization. That's similar to what we had with remdesivir, the drug earlier on.
Correct.
Where it was allowed to be used.
Yep. It's a way that the FDA allows things to get to patients quicker.
Great. All right. Well, again, to everybody here, our lab and our doctors who are using the convalescent plasma, we're very grateful.
And the donors.
The donors, for sure. And there's still a chance, if you wish to be a donor, to contact the Red Cross.
Absolutely.
Fred, on Tuesday, you normally give us the travel restrictions update.
Yep. This is the on the list, off the list.
On the list, off the list.
So actually today, the governor just took states off the list. So Alaska, Arizona, Delaware, Maryland, and Montana are off the list.
Off the list.
Now Guam, which is technically not a state, was put on the list.
Okay.
I don't know how many of us travel to Guam, but if that's in your travel plans, you're going to have to put a X through them.
I want to go to Montana. I've been watching a show about Yellowstone in Montana, so I want to go there.
Beautiful country. I've been there.
All right. Unfortunately, I don't have the T-shirt, but Driver Rehab. We got a T-shirt from Occupational Therapy, and they gave me a nice shirt. Maybe I'll hold it up Thursday about our new Driver Rehab program. And there's been some media buzz about this, and we wanted to take a couple moments and just talk about it here.
So Dennis, this is a simulator. It's an actual car chassis that you sit
Yes.
in, and with screens that are real images of driving, where we're able to manipulate exactly the road hazards, things that pop out in front of you, a deer that can jump
Right.
out in front of you, etc. And it's a way for our occupational therapists to test someone, for example, who's had a stroke, to see
Right.
whether or not they're capable of driving after that stroke.
And if I'm not mistaken, we're the only place in the area that has something like this.
That's true.
So
That's
it's a
true.
great resource.
And it's both for inpatients as well as outpatients.
And the referral source is often neurology, neurosurgery, and it's a
Yes.
way for people to get back on the road. And we have some occupational therapists who are specialized, trained in how to do this.
Two, actually, that are
for them.
trained to do this, that can really do a good job of evaluating patients.
Yeah, we have an incredible occupational therapy department, so congratulations to them. Also, congratulations to cardiology. Once again, the American Heart Association has given our cardiology department the Gold Plus Award for Get With the Guidelines on our treatment of heart failure.
This is an award that they've won many times. It's a credit to a lot of hard work. Dr. Ed Philbin, Fran Cavanaugh, nurse practitioner, and Chris Schaefer really drive this program. And it's about doing all of the things that are going to result in best outcomes
Yes.
for heart failure patients, including simple things like making sure they understand the medications that they're going to go home on. So, shout out to them. Fantastic. Once again, a gold award from the American Heart Association.
That is absolutely one of the best things about being able to do these videos, is a chance to congratulate people for their great work. So I join in congratulating them.
We have a lot of people who do great work.
We do. And speaking of which, the last thing is I want to recognize one of our security officers, Randy Katuna. Now, Randy, many people know, works at the desk at the A building when you come in. A lot of times we see him in the morning and say hello to
Say
Randy.
hello to them all the time.
So Randy is from the Philippines. He's been here for 3 years and 7 months, and just last Friday, he became a citizen.
Congratulations, Randy.
Yes, American citizen. He went through the whole process, and it's really remarkable. I've been to those citizenship ceremonies. They're really moving, and we want to congratulate him.
Fantastic.
We have a lot of employees, I think, who go through that, and we're going to try to recognize them as we go forward. So that'll do it for Tuesday. We'll be back again Thursday. We'll both be here,
Yep.
and we'll bring you some updates then. So once again, we ask you please take care of yourself, take care of each other, and we'll see you on Thursday.